Okay, we're going to talk about putting a wound vac on today. Negative pressure wound therapy. Got to get to the next slide. What is vac therapy? How does vac therapy help? 4 parts of the vac system, the indications for putting one on, vac dressing placement, step-by-step instructions, contraindications, vac dressing changes, and works cited. Okay. The vac therapy system is a medical device system that promotes wound healing by delivering negative pressure to the wound through a patent dressing and therapy unit, creating an environment that promotes the wound healing process. This negative pressure helps draw wound edges together, remove wound fluids and infectious materials, and promotes granulation tissue. Okay, how does the vac help? Provides a moist wound healing environment, draws the wound edges together, removes fluid and infectious materials, reduces the wound odor, reduces the need for daily dressing changes. Okay, there's 4 parts to the vacuum system. The vac therapy unit that delivers the negative pressure, which is the unit, sterile plastic tubing with pressure sensing lumens that connect the therapy to the dressing, which is, you guys see these coming out of the wound vac canister. The special granufoam dressing that we cut to the size of the wound, and the clear drape adhesive that covers the foam dressing. This is for chronic wounds, acute wounds, traumatic wounds, surgical wounds, dehisced wounds, partial thickness burns, diabetic wounds, venous or arterial ulcers, and flax and grafts. The vac dressing goes on or inside a wound. One end of the tubing connects to the dressing. The other end of the dressing connects to the canister, which we have here, that fits into the therapy unit. The wound area is sealed with the clear vac drape with adhesive that helps maintain negative pressure over the wound. Of course, on the step-by-step instructions, you always wash your hands, wear gloves, practice aseptic technique when doing wound care, be mindful of pain management and medicate for pain if appropriate. Always verify your doctor's orders. Cleanse the wound with wound cleanser, pat it dry. Apply Sure-Prep to the tissue around the wound, always working your way outward from the wound. Then you cut pieces of the clear drape into narrow strips and make like a picture frame around the wound edges. Cut granufoam to the size of the wound and apply it to the wound bed. Cover the picture frame and granufoam with a larger piece of the adhesive drape, trying to keep as many wrinkles out of it as possible. You cut a nickel-sized hole in the drape over top of the granufoam. Apply the suction tubing disc over the nickel-sized hole. Apply a piece of adhesive drape over top of the suction disc to ensure the seal. Connect the suction tubing to the canister tubing and be sure the canister is attached to the therapy unit. Turn the vac unit on and watch to be sure that the dressing vacuums down. That's a picture of what the granufoam looks like in a wound bed, with the drape covering it and the suction tubing on it. For non-infected wounds, KCI, the maker of our supplies here, recommends that the vac dressing be changed every 48 to 72 hours, but no less than 2 times per week. For contraindications, patients with malignancy in the wound, which would be a cancerous lesion, untreated osteomyelitis, infection of the bone, non-enteric and unexplored fistulas, which is an abnormal passage from a body cavity to an organ besides the intestines, necrotic tissue, which would be dead tissue, and sensitivity to silver. Some of the foam dressings have silver in them. And that's it. Thank you, guys.